Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Well, as we heard, holiday stress can be difficult, but sometimes anxiety, stress, and depression comes more acute and requires more intervention. Here's some information from Baptist Health in Richmond.
Suicide is the second leading cause of death in teens aged 15 all the way up to youth at 24. So at Baptist Health Richmond, we are here to support that population, and we owe it to our youth to pay attention to and help them through. Signs of distress would be social isolation, withdrawing, hopelessness, and a remarkable or notable change in their behavioral patterns. It can be overwhelming to present to the emergency department for a mental health crisis. So when someone presents to the ER for a mental health crisis assessment, they can anticipate to come in with their loved one. They don't have to disclose everything right away. They can just say that they're here to talk to a mental health professional. And then we will have a behavioral health clinician, a licensed therapist, meet them directly at the bedside. We'll do a full evaluation and consultation and work directly with that teen and their family in deciding what recommendations and referrals do we make at that time. It's important when a teen discloses to us that they're having these feelings of hopelessness that we listen and we're attentive and help them understand that this is a temporary feeling and that this too will pass. We have to sit with them and get them through and bridge that gap and help them move through the pain instead of succumbing to it.
Mental health crisis can affect anyone at any time, and there's no shame or embarrassment in seeking help for that. Over the course of the recent pandemic, we definitely saw an uptick in people seeking resources for their mental health. In general, there are some common changes in behavior and in emotional regulation that you might want to look out for. Some of those include rapid mood swings or aggressive behavior where someone was normally not aggressive. They might even make some suicidal comments. Sometimes they might play it off as a joke so that other people might not notice, but some people might make steps to even prepare for a future without them in it. At Baptist Health Richmond, we aim to provide preventative efforts, clinical treatment, and recovery support. Some of the clinical treatment that we offer includes individual counseling, psychiatric medication management, substance abuse treatment, and crisis consultation. If you or your loved one is experiencing what you believe to be a mental health crisis, I recommend that you call 988, which is the Suicide and Crisis Lifeline, or coming to Baptist Health Richmond Emergency Department, where we have behavioral health therapists and social workers available 24/7 to help you with crisis consultations and to connect you with services immediately.
The Thrive Center at Baptist Health Richmond is an 11-bed inpatient psychiatric unit for adults who have mental health disorders, including severe depression, anxiety, schizophrenia, bipolar disorder, self-harming behaviors, and suicidal thoughts. When a patient is admitted to the Thrive Center, they can expect to meet with our psychiatrist for medication management. They will have individual therapy, group therapy, family sessions. We have a recreational therapist who will do recreational activities. We also do individualized care planning and aftercare planning. And we also have access to case managers and peer support services. The goals of the treatment team are to help each patient achieve their individual goals and provide symptom relief and help teach them the skills to thrive in the community. Before we had the Thrive Center, patients would come through the ER, they would meet with a therapist, and then they would have to decide which level of care they needed. If they needed inpatient treatment at that time, then we would have to transport individuals outside of their community. And now that we have the Thrive Center, patients are able to be admitted to our hospital here at Baptist Health and stay within their community. I love being able to meet a patient where they are and provide compassionate care for them and help them along their journey to wellness at the Thrive Center.